Good morning, everyone.
Morning!
Hello, hello, hello. Thank you all for coming to this side of the building and not the other side, where there is an opposing press conference happening. But thank you so much for all being here. My name is Patrick Dunn, and I'm going to be your mistress of ceremonies for this, and will also be speaking at the very end. But I'm Executive Director of the New Human Rights Center and also Chair of the LGBTQ Health and Human Services Network here for Connecticut. So with that said, it is my honor to welcome to the stage our first speaker of our press conference. Yes, this is a stage, State Representative Jeff Curry.
Thank you, Patrick, and good morning, everyone. Thanks for those who are here in person and those who are attending virtually. About 3 years ago, building upon our legislative successes, a group of interested parties thought it was time that Connecticut provided a bit more prescriptive way for organizations and individuals to better support our LGBTQ+ community. With the support of then Governor Malloy, a majority of the Senate, all but 6 of our House colleagues, advocates throughout Connecticut, and most importantly, the people here today, we successfully passed and formed the country's first statutorily created LGBTQ Health and Human Services Network. And given that the LGBTQ+ movement is still generally greener than other human rights battles, it should come as no surprise that our rainbow community and our needs often live in the shadows amongst other marginalized populations. During a time when disparities, especially in healthcare space, have been at the forefront of almost every conversation, every presser, and legislative proposal, the purpose and intent of this legislation could not be clearer or more necessary. This network and this report are a huge step in taking us into the light so that we may better protect and care for Connecticut's LGBTQ population. I want to just thank the Commission on Equity and Opportunity, the Department of Public Health for their partnership, members of the network, Amy Griffin and Health Evaluations Initiatives, and all those who provided responses to the LGBTQ Needs Assessment Survey. With this critical information, the network will be better informed as they continue to help build a healthier and safer environment for Connecticut's LGBTQ+ community. And I know Representative Ali Brennan is not here with us today, but the LGBTQ caucus is small but mighty, and we look forward to a continuation of the network's work and the development of policy recommendations for upcoming legislative sessions. So again, thank you all for being here today, and congratulations on the survey.
Woo! Woo! Thank you so much, Jeff, and thank you for acknowledging Representative Ali Brennan. I think the two of you were our sponsors for this bill, and I had this whole intro planned calling you the gay team instead of the A team, but I can't do that. But you are our gay team, and we are thankful for all of your work at the state, for our community, and all of the communities of Connecticut. So with that said, I'm going to bring to the stage now Stephen Hernandez, who is the Executive Director of the Commission on Women, Children, Seniors, Equity, and Opportunity, which is where the LGBTQ Health Network is housed. So Steve, come on up.
Woo! Good morning, everybody. My name is Steve Hernandez, and I am the Executive Director of the Commission that is actually the administering body through the adept hands of our chair of the network. You know, for so long, our community, is the LGBTQ+ community, has suffered discrimination in silence. And part of the effects of that discrimination is that the health and human service needs of our communities, which are paramount to the success of individuals and communities and families in the state, have gone oft ignored. What's beautiful about this report, in addition to the cover, by the way, is that this is the first time that we are memorializing the needs of our peoples across the state and ensuring that not only are their voices elevated in this capital, but that from this moment forward, they are part of every conversation of note in the state so that their needs are met and their success is ensured. I want to thank each and every one of you for being here today. For those of you who are joining us virtually, this is only the beginning. This network is not going anywhere. And through the leadership of our leaders here in this Capitol, we're going to make sure that you have a voice right where it belongs. Thank you all so much.
Woo! Woo! Thank you so much, Steve. And to everyone at the Commission who supports the work of the network, both as the network, but all of our individual institutions that are member organizations. Next up, I'd like to bring Amy Griffin, who really, we couldn't have done any of this without Amy. Amy is the Director of Health Evaluation Initiatives at the Consultation Center at Yale, and was the lead person really running this survey and created this beautiful report. Please take a copy. They are right there on the ground. But yes, Amy, please come up to the podium.
Thank you. I'm honored to join the network and the Commission and the Department of Public Health to share the findings from the first statewide LGBTQ+ needs assessment. Conducting a needs assessment is a vital component in addressing concerns about health, equity, and quality of life to better understand the perceptions, lived experiences, and specific health and human service needs of LGBTQ individuals living in Connecticut. Ensuring that as many people as possible had the opportunity to have their voices heard was made more challenging by the pandemic. However, network members worked tirelessly to broadly disseminate the survey, resulting in more than 3,000 people completing it. Survey respondents closely mirrored the Connecticut population in many ways, including geographically and with regard to their race and ethnicity. The results from the survey provide novel information about gender identity and sexual orientation that was previously not available for our state. The survey asked respondents about the types of services they have accessed in the past 3 years, their experiences receiving services, service access barriers, and current needs. Some, just a few, important findings include: more than half of respondents experienced some form of violence as a result of identity-based discrimination. Almost half of the respondents who reported accessing housing services had concerns that these services would not be LGBTQ friendly or affordable. Although most respondents had successfully accessed healthcare services in the past 3 years, many reported unpleasant interactions and experiences with healthcare providers, creating a barrier to accessing needed health care. Mental health services were reported to be highly accessed by respondents. However, more than half identified concerns or barriers related to accessing these services. Generally, respondents feel that Connecticut is making visible efforts to meet the needs of the LGBTQ+ community, and that Connecticut is a relatively safe place for members of the community to live. However, more than 400 respondents added comments to the survey that included their suggestions for enhancing the quality of life in Connecticut. Respondents indicated that it is very important for Connecticut to strengthen policies and modify forms to promote a more inclusive environment for the LGBTQ+ community. Discrimination against the community is still pervasive, particularly in the workplace and in medical settings. Discriminatory experiences with law enforcement and some religious communities were also mentioned. More training for service providers, law enforcement, and other professionals is needed to work with LGBTQ individuals safely and effectively. More needs to be done to raise awareness and meet the needs of LGBTQ individuals who also experience racism, ableism, and/or classism. It's important to note the appreciation felt by the individuals completing the survey, many of whom took the time to thank us for providing them with an opportunity to be heard. Here are just a few of their comments. I was in the group of gay and lesbian people that stormed the Supreme Court in the 1980s during the AIDS years, when people were afraid of gay people. I am glad you are doing this survey to support the younger people so they can express themselves as they are. Thank you. I think Connecticut has come a long way in terms of making it comfortable for us to live our lives. Thank you for asking us these questions. And lastly, thank you for working on this survey and helping our community. It's nice to be heard.
Woo! Amy! Thank you so much, Amy. So I'm going to wrap us up with just a couple words. First and foremost, I just want to just say that the LGBTQ Mental Health and Services Network, which is a state, again, a subcommittee of the Connecticut Commission on Women, Children, Seniors, Equity, is proud to release this full survey. I have lost my ability to speak. This is why I'm not supposed to read comments. I'm just supposed to go. Is proud to release these results. This is the first time in our state's history that our community has been asked these questions. And to all of my colleagues that I see from our various LGBTQ+ nonprofits from around our state that are here today and watching virtually, we all know this information because we live it every day. All you have to do is work in our nonprofit sector for a week and you see the data. but we had no way to quantify it to funders. We had no way to quantify it to our legislature, and we had no way to qualify it and quantify it to all the people who wish to support us but require that information. I'm going to tell you a little story. There was a number of years ago at the New Haven Pride Center, we had the opportunity, we were invited to a national grant that was being awarded. It was $50,000. It was going to be invested in our state and our community. And the ultimate decision was, Connecticut doesn't need this money. And it was because we had no way of showing that our community experiences homelessness at a disproportionate level, that in our state at any given moment, 20 to 40% of young people under the age of 25 are homeless or food insecure. It doesn't cover the fact that so many people have to go to the Health Collective in Hartford because it's the only place they can get comprehensive health care in Hartford. It doesn't count for the fact that there are people who are living with HIV and AIDS in our state who cannot find stable housing, and it's thanks to organizations like AIDS Connecticut, like APNH in New Haven, like Apex in Danbury that make it possible for these folks to get housing and be secure to find jobs and live their lives in their fullest. It's because of organizations like the Triangle Community Center and the New Haven Pride Center that provide case management support for our community. We know that this work happens constantly around our state, but we had no way of telling people how we do it. And this report right here is going to make that possible. This report is going to bring money into our state to ensure that our community has every right to thrive as every non-LGBTQ plus person. So I just want to thank all the appointed members of the network, which include Charlie Ortiz, Robin McKalen, myself, Edson Rivas, John Mertz, Ashley Holbrooks, Kelsey O'Neill, Linda Estabrook, Diana Lombardi, Kai Beard, Steve Hernandez, and Harry Ostrott, who represents the Connecticut Community Care. I also want to thank all of the people who participated in this survey, from the people who came to our meetings literally every few weeks who were not required to. I want to give a big shout out to Lane specifically to ensure that our questions around trans identities were as comprehensive as possible. And again, I want to thank all the people who took a moment to take the survey and give us this beautiful, beautiful report that we can now use to hopefully change our community for the better. So again, thank you everybody for being here today, and thank you for watching online if that's where you are. Have a great rest of your day. Woo! Woo!